Hi, this is Brittany Wastel. I am taping my cardiovascular and respiratory assessment, and this is Anthony helping me out once again with that. To start this assessment, I would watch the patient breathe, noticing any retractions, accessory muscle use, symmetrical rise and fall of the chest, just checking to see the rate and how he's just breathing in general. Moving on, I would palpate all the lung fields in the posterior, starting above the scapula, going side to side, checking for any tenderness, masses, fremitus, anything subcutaneous air, which I don't feel. Then moving on, I would percuss using my middle finger of the left and then the middle finger on my right. And then over here as well. Then I would also percuss the costovertebral angle. Good. And then using my stethoscope and using the diaphragm of my stethoscope, I listen to Anthony's lung fields. Starting at the top, go ahead and take some big deep breaths in and out. And I'm hearing bronchovesicular lung sounds up here. As I move down, beginning to hear vesicular lung sounds. And his lung sounds sound nice and clear. Anthony does have a history of asthma, but there's no wheezing, no crackles, no abnormalities noted in his lung sounds. Moving to the anterior chest, I would do the same. I would palpate the lung fields using my fingers, any tenderness, masses, abnormalities, which I do not feel once again. Also in the anterior, I would palpate using my middle fingers here. Listening to the sounds. And then auscultating with the diaphragm once again in the anterior chest. Go ahead and breathe for me. Hearing bronchovesicular and then bronchial as we're over the main bronchus of the lungs. And as I move down, hearing vesicular, and actually in Anthony you can hear some slight wheezing in expiration, excuse me. Good. He is on nebs and inhalers for his asthma for that abnormality. Then moving on, I would move on to my cardiovascular assessment, looking at Anthony's neck for the carotid artery and the carotid pulse, and feel that once again as we did in the HE and EENT assessment. And then going down here to the apical pulse and feeling the apex and the base of the heart. Good. Using my stethoscope, and this time to hear the heart sounds using the bell of my stethoscope, I would go over the aortic. You can breathe normal. The pulmonic. Listening for any murmurs, clicks, rubs, or abnormalities. The tricuspid. And then the mitral areas of the heart, and not hearing any abnormalities there with that. In practice for this assessment, I would have the patient sitting upright. I would then have him lean forward and then in the left lying position. After my assessment is done, I would wash my hands. This concludes my assessment.